Hello, Blazers. Welcome to episode 140 of UAB Green and Told, original debut Monday, December 30th, 2024. Through this podcast, we are able to share stories from members of the UAB community. Want to listen into previous episodes of UAB's most listened to podcast? Check us out at alumni.uab.edu/greenandtold on Spotify or the Apple Podcast app. While there, leave a written review that'll help other alums find us. I'm Greg Berry, a UAB alum and Director of Communications in the Office of Alumni Affairs. Today, we dive deep into the complexities of public health, mental health, and the power of personal narratives. Courtney Worley will share insights on how systemic changes can significantly impact individual well-being. And it's not just about personal effort. Sometimes it's the environment and policies that need a health check.
Sometimes it's a lack of education. Yeah, we can sometimes help that, but sometimes it is the built environment. Sometimes it is the access. Sometimes it is things that have to be changed by policy.
Plus, Courtney will delve into the significance of personalized care in mental health treatment, recognizing that each individual brings unique experiences and goals to the table.
You're the expert on you. So I've got the book learning. I've got some ideas about how we can make some changes, but I have to know what your goals are. Where do you want to go? What are you trying to do?
And we'll explore the therapeutic benefits of writing about traumatic experiences, a practice that can help reframe and manage difficult memories.
Writing about it, while it is difficult, the exposure of it, going through it again and again, really helps the brain to process it, to kind of take some of that emotion out of it, to store it away like a regular memory. I think being somebody who processes things internally a lot, being able to put some of that out onto a canvas, being able to work through some things in that way has been really, really helpful. You know, I got away from it for a long time in my life. I mean, going to school forever will do that because I was not academically focused in art. I was in several different areas, as we'll talk about soon. But I really came back to it several years ago and started to kind of blend my experience in academic medicine and as a woman in healthcare with some of the things that I was already doing with my patients. So I really took on this idea of finding a mindfulness practice through my art. So it's a time for me to stay focused in the present moment and pay attention to what is developing or unfolding on the canvas, on the paper, through the different mediums. And it's just a place where it really helps me to recenter.
You talked about patients, and we'll get there here in a little bit. You went to undergrad at Samford as a psychology major. Did you know you wanted to go into psychology when you were growing up, or was that just kind of a landing point?
I went back and forth. It was something, and I joke about this, and I actually wrote about some of my grad school essays about Bob Newhart. And so I watched Nick at Night when I was a kid, and I thought it was really cool that people came to his office and he talked with them and kind of solved problems and being a problem solver. It was something that I was kind of gravitating towards, but I actually went in undeclared. I wasn't sure. I wanted kind of the robust liberal arts education, so I knew I would find something and explored some different things, but had some mentors early on that helped me to solidify that interest and to expand kind of all of the different things that I could do with psychology. It has not been a linear path, but as I reflect back, I can see how a lot of those side quests led me to where I am today.
You didn't waste really any time. So it was kind of linear for a little while, at least, where you got your undergraduate degree. You chose to come to UAB to get your master's, but you didn't get the master's in psychology.
No.
Well,
Oh.
why not?
Public health. It's something that one of my undergrad professors kind of suggested to me because they knew that I was interested not only in changing things one by one, but thinking about working with individual patients, but thinking about kind of large scale applications. And so growing up in Alabama, living in places where there have been a lot of health disparities, experiencing that within my family, on a personal level, but also seeing it impact communities and societies, I really got to thinking about how I could make an impact on a broader scale. And so public health was really something that was brought to my attention as, hey, health behavior, thinking about how we apply these things on a bigger scale, thinking about population-based interventions, that might be something that you're really interested in. Even if you decide you want to go later and do that PhD and get that clinical psychology degree, because that's what I was thinking about. So this might be a really good intermediate step for you to get some other experiences.
You have a nice luxury of seeing the demographics and the disparities in multiple communities in Alabama,
Mhm.
Montgomery, Dothan, Birmingham, living in all three. How drastically different are those, and how did that help shape you?
Oh, wow. We can add a couple more dots to the map too, based on, where I had family and other experiences and, spent some time in Tuscaloosa too. So I think, there are parts of the story that are similar. There are parts of the story that, I really want to help change the narrative for Alabama, in how we can make changes at a population level, right? To think about the built environment. So that may be one of the differences, right? Being in Dothan, much more rural, much more opportunities to kind of be out in the world, to walk, to do other things, as opposed to some of the food deserts that I worked in Birmingham. I had the opportunity as part of a research project to work in a health department where their access to fresh fruits and vegetables in a rural area is something you don't think about, right? Because we can go to the grocery store, use those roadside food stands. It's easy to get access, but in some of the areas that I was seeing in Birmingham, there were food deserts. There was not access to get healthy, fresh fruits and vegetables, and so it wasn't just a matter of cost because that was also an issue, but it was accessibility. Like, where do we get that? And so thinking about how to navigate and how to help people work with what they have and what they have access to was a really big shift between the different environments.
You mentioned that it was important to you to change the narrative in Alabama. Why specifically Alabama and the focus there? Yeah, you're from here, but you could go anywhere.
Well, I would say that narrative has changed across time because I have started working across broader parts of the United States and do a little work internationally as well now. But it was really out of this sense of, there are a lot of people here who are trying to do a lot of things right. And sometimes it's not the individual that's the issue. Sometimes it's a lack of education. Yeah, we can sometimes help that, but sometimes it is the built environment. Sometimes it is the access. Sometimes it is things that have to be changed by policy, that have to be changed by um, larger stakeholders being involved. And so if I have these opportunities through education, through moving into these different areas of the work to be in these different circles, then I can kind of have that voice and say, but what about, right? How do we make these changes so that they move through all these different kind of concentric circles that impact people's day-to-day lives?
So, how has your career kind of shifted and changed in the last 15 or so years since UAB, since your undergraduate days at
Yeah.
Samford?
Yeah, so I went on to, to Alabama in Tuscaloosa and finished my PhD. I went to Florida for a year for my residency, and then came back and worked at a VA in Alabama. Ran a trauma recovery program, which is not something that I could have forecasted would have been on my radar, but really enjoyed it a lot. So working with veterans was something that was really challenging and really rewarding all at the same time. Um, and I got to do some things because of that larger system that were kind of unusual for my peer group or for people I knew. I got to connect with the National Center for PTSD and then be involved in several projects with them. And that was before we did so much telehealth and so much globally. I did a lot of phone calls and emails and kind of connected through that system. And that's something that, reflecting back on it now, it's those partnerships are easier to establish than they were when we first started. But I was trying to get more resources for my team, get more resources for my patients. And so connecting with this larger system and kind of bringing things back and best practices help to build some relationships that have paid dividends for me professionally, but also hopefully for the communities that I influence. And so that's where I got to be involved with some additional training opportunities where I get to train, other clinicians across the country in VA in some of these different evidence-based psychotherapies that catapulted into, when people learn your work, when people see what you do, other doors open. And so I've gotten to do some work outside of VA with community providers across the nation, and got to work with a project to actually train providers in Azerbaijan to deliver written exposure therapy, which is an evidence-based treatment for PTSD. And so providing consultation on their cases, which was really, really unique. And so that was an opportunity to think about how to take things and scale them. So we're not just impacting the individual. I can see a lot of patients, but there's a limit to that, right? As one provider. But if I can then train clinicians and help them to navigate the systems that they work in to change the practice, then a lot more lives can be impacted.
Veterans and veteran care
Mhm.
is very honorable, but it's also, you alluded to, it has its challenges. What were the challenges of working with the veteran population?
I think that there are some values and beliefs that can be advantageous in military service that then don't promote treatment seeking. And so this idea of, figuring things out for themselves, we just keep going and going and going, that's one of those strategies that in the short run can really, really help. In the long run, it's not going to fix some of these medical and mental health issues that our veterans face. And so I think, engagement is a really challenging thing, to make sure that people know healthcare is available and what it is, and to make sure that that people are aware of what the care options are that are really going to make the most difference, like evidence-based treatments. But then, how we talk about evidence-based treatments and how we present it makes a big difference. So one of the things that I carry across my career is something that was instilled on me early on, is kind of the mark of somebody who is intelligent is that they can switch to talk to anybody that's in front of them in a way that communicates with that person. So taking into account individual and cultural diversity issues, taking into account, education and intelligence, right? So changing the jargon that I would speak to another healthcare provider to the language that makes sense, so that we can work together and make some decisions with healthcare access and the patients in front of me.
Post-traumatic stress disorder is something that's been around for a long, long time, but it really didn't start.
Millennia.
Yes, but it hasn't been commonplace until probably the last 20, 25 years. It's just been kind of pushed off. When you started doing your research, when you started working with PTSD patients, how much did you know about that realm?
Well, I think there is a difference between how much you know from the research and how much you learn from the people in front of you. And so, that's something that I try to stay really humble, and I talk about, with my patients, you're the expert on you.
Mhm.
So I've got the book learning, I've got some ideas about how we can make some changes, but I have to know what your goals are. Where do you want to go? What are you trying to do? Um, and then thinking about, what messages people have received about coming in for care, about what their symptoms mean, or what it might mean if they do get better. Is recovery even possible? Because some of the early narratives were very much, you just have to live with this.
Yeah.
And we actually know recovery is possible, that things are very different. We've learned a lot in the past 25, 30 years. We continue to learn more about how to help people. So sometimes I would see Vietnam era veterans who were coming in for the first time at retirement for care, and maybe they came to the VA or they went somewhere else once or twice and were just kind of told they had to live with it. And they may be coming back in now because something has changed. And so we kind of have to work on challenging some of those beliefs too, about I was told all this time, or some of the ideas that may come up because I didn't seek care sooner, is kind of a myth. And right, there's never a right time. There's never too early and it's never too late. Kind of lots of different doors to get to care. But sometimes those beliefs get in the way, and sometimes other people get in the way.
Talk a little bit about the written exposure therapy. I know it's a 5-session evidence-based psychotherapy for PTSD, but elaborate on that. What exactly is it? Where did it come from, and how does it help?
Sure. So there are actually four evidence-based treatments that are psychotherapies, talk therapies for PTSD, that we typically think about as having the most support behind them. That we've compared them to other treatments. We've looked at how they work with different populations and trauma types, and you know. Do they work better for men or women, or different types of trauma? Spoiler alert, there's not a good formula for what treatment is best for any particular trauma, which in some ways is a good thing, because that means that we have lots of different options that could work. Written exposure therapy is not necessarily a new treatment. It's kind of a repackaging. So it uses this idea that's twofold. One is imaginal exposure. And so exposure-based treatments are used for lots of different concerns, anxiety disorders, trauma, lots of different things use exposure-based treatment, but it's the idea that avoidance and unhelpful thoughts and beliefs are the things that keep people stuck on their recovery journey. So lots of people in life are exposed with trauma, but only a small number of those go on to meet criteria for PTSD. And so if we look at what changes, everybody has this natural capacity for recovery from trauma, but some people just get a little stuck on that journey. And so we do things to get them unstuck. And so exposure is part of that. And written exposure therapy actually comes from a treatment that was developed in the 1980s called expressive writing. And so the idea is that if we have people to write about their experiences, with the inclusion of thoughts and emotions, they can make some progress in kind of untangling some of their experiences, making sense of it, storing away like a regular memory, as opposed to trauma memories that are kind of just keep popping up.
Sure.
In expressive writing, it was kind of write about whatever you want to write about. There saw differences in how people were functioning, physical outcomes and emotional or psychological outcomes. And so written exposure was taking that and refining it and making it more trauma focused. And there was a lot of experimentation done with different versions of it to see what is the right amount of time that people need to write, how many sessions, how do we focus people in on particular events. And so written exposure therapy, as we know it now, is 5 sessions. It's a really brief intervention that's done individually, one-on-one with a therapist. where people are asked in some specific ways to write about their experiences and process some of that with a therapist. There's no out of session assignments, which is a really popular thing. Other treatments often ask people to do activities between sessions to build on that recovery, but with exposure, written exposure, it's just we ask people not to avoid. Allow those thoughts and memories to come. Let your brain work on them in a purposeful way. And we really see some really nice results with people not only reporting reductions in symptoms, but also with people being able to engage in their life again. And so functional changes, right? Improvements in relationships, their ability to go out and do things that are consistent with their values. So it's really a nice treatment option. So that's why I've spent the last 6 years trying to help train clinicians to be able to deliver this, to create another option for care, not only for veterans, but I'm also doing some of this work in the community as well, working with healthcare systems across the United States.
A, it cannot be easy for these individuals sometimes to put those thoughts onto paper. B, it's got to be difficult sometimes to read through them.
So I think it takes a lot of courage to do treatment, and
Yeah.
I'm not sure that anybody is ever ready. We talk about willingness, right? And so we think about what are you willing to do to change? What are you willing to do to meet those goals that we've set? But, it's revisiting a memory. Memories aren't dangerous, even if they feel bad. And people have already been through the trauma. And so writing about it, while it is difficult, the exposure of it, going through it again and again, really helps the brain to process it, to kind of take some of that emotion out of it, to store it away like a regular memory. So I think about, you know, trauma memories are there because it's a reaction to a really unusual event, right? We don't know how to store these experiences. People aren't supposed to hurt you. Bad things aren't supposed to happen, we think. And so when they do, we have to make it fit with our experiences in life. And it's kind of like sometimes trying to put a square peg in a round hole. And so retraining the brain, what to do with that memory, teaching it how to store it away is really an impactful piece. You ask about being able to read through or sit with people. That's really an honor and a privilege. And I won't say that I'm I'm never impacted. Of course, as a human being, you have empathy for other people and their experiences. And I also have a lot of good tools and resources at my disposal to make sure that I'm in the best shape I can be to be able to be present, to be able to do those things and to recognize, it's not my experience. And the way that I've been trained to listen to and pay attention to those things is not as a person who experiences it, but as a person who is looking for ways to help somebody feel those feelings, process those thoughts, if we need to challenge some of those beliefs that may have gotten them stuck.
Some of these narratives have to be very poetic or poignant. How satisfying is it for you when you see something like that that just draws out so much art just to kind of draw it back to the
Yeah.
beginning of our conversation?
Yeah. So it's amazing. I mean, it's a really, really unique experience to sit with people and help them to untangle things that they've been carrying around for 5, 10, 50 years. And to kind of see when that change happens or even starts to change, that there's a way that maybe they can live with this memory or with this experience as opposed to feeling like it controls their day-to-day life. And so, I I started doing trauma treatment more than a decade ago and I'm still doing it because it is something that is an amazing thing to be a part of.
How has your master's in public health from UAB specifically
Mhm.
helped launch your career where now you are going seacoast to seacoast, ocean to ocean, north to south, and really
Virtually.
impacting virtually? Hey, however you're doing it, but you're able to do it on a national and global level.
Yeah. You know, I'm really thankful for that push, right? To think about a master's in public health. And mine specifically was in health behavior. And so that has been something that has returned tenfold, a hundredfold, because sometimes I like to joke that I'm interdisciplinary all by myself. And so I think about how, what my training as a psychologist teaches me lots of times to intervene at the individual level. My training in public health thinks about how we can scale those things, how we can involve all the stakeholders that maybe need to be at the table, how we can take into consideration what we know about behavior change, not only at the individual level, but at the team level, at the system level, and working across diverse healthcare systems. Lots of times the barriers are systemic. And so how do we help individual clinicians navigate some of those changes, because they raise their hand and say, hey, I want to get trained in this new therapy and I want to start using it with my patients. you know Sometimes the best intentions can get waylaid by, well, we don't know how to set up those appointments for you, or how do I start this new process of getting these new referrals, or we don't know how to code for that, whatever it is. Or maybe they think, oh, people should just do this and this and this, right? Or it doesn't fit into the appointment time, whatever the barrier is. Public health has taught me to think about those kind of ecological ways of mapping different interventions into systems and communities.
We talked about your interest in
Mm.
art growing up and that you've
Yeah.
always been an artist. You're still doing art now, but you're also intertwining that kind of with your career to a certain extent. What are you doing and how does it help?
One of the things that I'm working on right now is we have a book. A colleague of mine, Michael Nadorf at Mississippi State, and we're writing a book about nightmare treatment. It's something that we've been doing for a really long time. I say we, not in Dr. Nadorf and I, but a lot of people. We, as a community of therapists, and so we're working on a self help version of that book. And one of the things that is a common element of nightmare treatment is the idea of being able to rescript or rewrite that nightmare into a new dream, something you want to dream, rather than this nightmare that replays that disrupts your sleep. And so one of the things that we're working on with this book is that ties a little bit into art is I've been sketching and drawing a map that kind of represents the different treatment elements and almost like a choose your own adventure, right? So how do we progress? How do we visually represent this progression through treatment? And so I think there's a piece that I put out into the world with that, but there's always that piece of art that is part of my mindfulness practice that helps me to be ready to be the best clinician. So it kind of serves a twofold process.
That's Dr. Courtney Worley, a 2007 graduate of the School of Public Health, where she earned her Master of Public Health. Today, she works with the Alabama Research Institute on Aging and is a staff psychologist with the VA Pittsburgh healthcare system. As someone devoted to improving healthcare in Alabama and beyond, Courtney has a great idea of what it means to be a blazer.
It means someone who is dynamic and can respond to the challenges of a modern world, whether that's academically or healthcare focused, because I think a lot about healthcare when I think about UAB and being a blazer, but it's really about having a lot of skills to be able to navigate and move through different situations.
Be sure to check out past episodes of the UAB Green and Told podcast. Listen in at alumni.uab.edu/green and told. Have a story to share or know someone who does? Email greenandtold@uab.edu. Finally, be sure to follow us on social media. Just search UAB Alumni on Facebook, Instagram, and Twitter. Thanks for listening, and until next time, go Blazers.